Okay, I'm going to officially start the meeting. We have people still coming on board, but I just want to make sure that we can cover a lot of the stuff that I'm going to be talking about is more kind of administrative. Since this is our first quarterly meeting of the new year, typically we have a lot of kind of admin things that we need to take care of. And I just want to welcome everybody and thank you for joining us today. We are also usually using Zoom through Generations for a number of our different online events. So I want to thank them for the use of their Zoom account. And I also want to kind of give you a heads up that there's been a little bit of a change in schedule. Lieutenant Governor had a cabinet meeting, their cabinet meeting was rescheduled. And so he's going to try to come on at 12 noon. So we're going to try to rush through our portion before he comes on. When he comes on, we will go ahead and just kind of pause and then we can continue after he finishes with his portion. We are going to be installing new officers today as well as 2 new directors, but I do want to introduce all of the board of directors to you. I'm off their names, and if you are on, if you can wave your hand vigorously so that we can try to identify who you are, and you know, people like Eileen who are at work and are wearing masks, it might be a little bit harder to recognize them, but and Cynthia. First of all, I am Debbie Kim Morikawa. I am the current president. My term just started in January. We have Rick Tabor, who is our president-elect, and he is also going to help me co-host this Zoom session to make sure that we have smooth coordination of all the different functions, getting all the questions responded to. And then Eileen Phillips, she is the past president, who did a tremendous job. Oh, I like that job last year.
Aloha.
Arnold is our secretary-treasurer, and she did a job of doing our financial reports every month. I know I saw Laurie Adamczyk. I'm just going to go through the list of the board members. Poki Ibalaz, Humberto Blanco, I believe I saw him as well. Kathy Jaycox, Sarah Lenza Medeiros couldn't be here this morning, but Christy Nishita is the head of our scholarship committee. Marcy Saquin, and please help me if I'm not pronouncing that correctly. Rick Tabor, I introduced you before. I need to take him off that director's list. And John Tomoso, or actually Haoli is what he prefers going by. Okay, so we are your board and we are here to serve you. So I'm hoping that you'll reach out.
Kathy Wyatt.
Kathy Wyatt.
Thank you.
I'm sorry, Kathy, you dropped off of my copy and paste list. Okay, and Kathy Wyatt, she, you know why? Because I think you were originally on my past president and then that dropped. I changed it and didn't put it on the directors. Apologize for that. As a reminder, if you haven't renewed your membership renewals are starting. You will be able to find that form at the end of the newsletter that got mailed out to you in the beginning of the year. So at the end of, oops, wrong one. So at the very end, there's the renewal form. It looks like this. All you need to do is fill it out. If you have any questions, just give Sherry a call and she can walk you through it. Okay. So we hope that for those of you who have been regular members, that you will reach out to others and ask them to join. We really feel like, you know, this is an important organization. And I don't know if you were in early on when Marilyn Seeley, who was the former director of the Executive Office on Aging, you know, talked about how HPGS first started out. We are the one of the largest. Let's see, a lot of people coming on. Hold on one second. So basically, we are one of the largest statewide organizations that focuses on aging issues. And as the largest network of a diverse group of professionals, individuals, and companies, it's a great opportunity to connect with people that all share the same goals and objectives. We also have a biennial conference that if you are a member, you will definitely receive a discount. We publish monthly newsletters that are packed with information about upcoming events, announcements, and other age-related news, job openings, and a lot more. Sherry does a great job of putting out the newsletter each month. By the way, I'd like to introduce, I forgot, Sherry Goya, who is our executive director. I know most of you know Sherry probably more than any of us, but Sherry is an absolutely wonderful executive director. She keeps us all in line. So I do hope that you will all make sure that you renew your membership, that membership dues are what helps to sustain us in addition to our annual fundraiser. I'd like to transition now to our annual report, which is a recap of what happened the year before. Eileen Phillips submitted that report and kind of gave me an overview of the things that we focused on last year, and that report will be available on the website. We started 2020 with a focus on our biennial conference. Kathy Wyatt and Eileen Phillips were the co-chairs for that committee. And they were so excited about creating an event that would give professionals in the field of aging a chance to gather and share evidence-based knowledge from those in our community and around the world. The theme was to be 2020 vision, but obviously didn't happen. With the pandemic, we had to reschedule. So we are having a conference this year, and this year's conference will be focused on planning both for a virtual as well as an in-person event, so that no matter what, we will have a conference. We're just not sure what venue we'll be able to have, depending on the direction the pandemic goes this year. Hopefully vaccines will get out and we will be at a point where we can open up a little bit more. So the conference will then be starting to, again, as a biennial, it will be on odd years instead of even years moving forward. COVID-19 has forced us all to become just a little more tech savvy. So, enter Zoom. We were only able to hold one in-person general membership meeting, and the rest of them were held on Zoom. That being said, we had some very interesting presentations and discussions. In January, we had Gary Powell from the Caregiver Foundation and Diane Terada from Catholic Charities. In July, we had a panel discussion on COVID-19 and the impact it's had on various companies. In October, we had a panel of the heads of each of the county's offices on aging, and another really excellent discussion to see what everyone is doing to address the pandemic and how we can better serve all of the kupuna in our communities. We awarded 4 college-level scholarships in the amount of $1,500 each, and there was a joint Center on Aging and HPGS scholarship, which we're fortunate that we get the credit, even though we don't necessarily put funds out from our own accounts. And we had 1 elder care worker scholarship in the amount of $500. We continued our monthly board meetings and committee meetings on Zoom, and we're pretty active in that venue. We held 7 webinars and also continued to distribute the monthly newsletters. For this year, we anticipate our base budget for 2021, excluding the conference, because we're not really sure, again, the venue, but the base budget went about $2,500, with the key line items allocated for scholarships, our part-time executive director, community programs, which focuses on providing a little more support to the neighbor islands, and then administrative costs like insurance and tax services. So, on a side note, just before we kind of transition the installation of new officers, I'd just like to comment that even though this year has really been very challenging, there have been some silver linings. This has been a great opportunity for the health systems to ramp up their telehealth models, which has allowed people to access services from their own homes in a way that they have never been able to do before. It has also kind of motivated our kupuna to learn to be a little more tech savvy in using their computers or their smartphones. And what that's done is allowed people who have had limitations in transportation the ability to participate in more community programming or events, or connect with people in the community where they might not have been otherwise able. So, in this environment of physical installation that all of our kupuna have been asked to maintain for their own safety, we've also provided them with new venues for them to be more connected with the outside world. Okay. Because of all the changes that have happened in this year, we've had to adapt because of COVID to a more virtual model. We thought that this was really a good time to reassess HPGS as an organization. You know, HPGS was founded in 1979, and as a network and advocacy organization, you know, we've come a long way in recognizing the need to focus on our kupuna and making sure that they have the quality of life that they so deserve as they get older. But what we need to be able to do is make sure that all of the things we're doing are still relevant, especially after a COVID year where we've had to adapt and change and create different models of doing things. So we are going to take this year to reassess and make sure that we continue to be relevant and that we continue to support all of you, our membership, in the ways that will best serve you. So I'm hoping that you will reach out to me and let me know if there are certain things that you feel we really should be prioritizing as an organization to make sure that we meet our mission of making sure that there is a solid workforce that's going to serve our kupuna, as well as that they can enjoy the quality of life that they deserve by making sure that all of the services that support them have the benefit of the knowledge and the information that we can share. Okay, I'm going to turn this over to Sherry to do the installation of officers. Sherry, did I miss anything?
No, sounded good.
Okay, all right, so I'm turning it over to Sherry.
Okay, as the Executive Director of the Hawaii Pacific Gerontological Society, I'm pleased to have the opportunity to induct the 2021 board officers and directors who are here today. The new directors that are here today is I believe, is Marcy available? Sarah, we had 2 new board members, as you saw in the January newsletter. And usually at this meeting, we induct those new ones. I did not see Marcy's name on the screen. But
Yeah,
we
I
do
don't see
have
her.
our 2021 HPGS officers. The president is Debbie Kim Morikawa. The president-elect is Rick Tabor. And the secretary treasurer is Cynthia Arnold. The 2 new directors are Sarah Lenzer Medeiros and Marcy Saquin. So if I may have you raise your hand and say, I will, after I read the following. Will you make a firm obligation to attend meetings regularly and prepare fully for each assignment, to apply yourself to the bylaws of HPGS, to participate in activities in HPGS, and to present HPGS to others in a positive, constructive manner to build an open, friendly relationship with our fellow members, and to bring other new members to HPGS so that they can also gain the benefits of this organization?
I will.
I will.
Thank you. Welcome.
Okay. Okay, well, as I mentioned, Josh Green, Lieutenant Governor Josh Green is not going to be here until possibly 12. Sherry, did you have any announcements?
No, just for this year that we do have the general membership meetings every quarter. And I believe we've preset them for, today is January 21st, April 22nd, I think it was July 22nd, and then in October 21st. These general membership meetings, today we have, I think there were like 28 people here, which is more than we've had the in-person. But what's good about the Zoom general membership meetings is we have people from neighbor islands. So we have Humberto, who's on the board. He's from Kauai. I believe John Haoli Tomoso is trying to get on, and it might be from his phone, but he's from Maui. We do have Sarah, who is from the Kona side, and Marcy, who is from the Hilo side of the Big Island, Hawaii Island. So having the Zoom this year has been able to have more of our membership participate in these type of events, general membership meetings, and definitely our board with having someone from almost every island. So that's something that we have strived to do with Eileen's term last time, and Debbie acknowledges the strength of having Hawaii Pacific Gerontological Society be one of the islands of Hawaii. Webinars is something that I don't know if you want to discuss that, or Poki'i, I believe she's on.
Yeah, I think we're putting the webinars on hold for right now. So one of the things I want to maybe kind of share a little bit of what my thoughts are for this year. As an organization, I know that even though we have made many strides in this field, there are still lots of gaps that need to be met. I mean, we're constantly being told of people that are leaving the field. We don't have enough caregivers for our kupuna. It's hard to get people into this field, as to choose it as a profession. And so I really want to take a look at how is it that we as an organization can really start addressing this better. I know that the scholarships have been one of the venues that we've tried to use to encourage people into this workforce, but the number of scholarships that we can provide is relatively small compared to the impact that we want to have. The other area that I really want to take a look at is just really the identifying what is it that our membership really wants from our organization. I know that, over the years, kind of the membership has kind of shifted and changed, the focus has changed, but I just wanted to really get a sense from our membership, where do you think that we should be focusing our time? What would be most beneficial for you in your field in working with kupuna? So I'd like to just kind of open it up, since we do have that time and we have a lot of people on this call. If you can share, what you joined HPGS for and what it is that you feel would be really helpful to you if we were to either focus on or provide resources or maybe support. And again, keep in mind that we are a volunteer organization, so it's not like we have funding to do these things, but I think the value of our organization is that we have a large, diverse network with a lot of very capable, knowledgeable, experienced people. And to me, that's the strength of our organization. And I really would like to see, us being able to tap into those resources a little more this year, and maybe do things more with our own networks in educating and prioritizing how we can have a greater impact on our communities. So I'm just going to kind of open it up and ask you, if you can, maybe the easiest way would be if on the chat, you can just type in your name, and then Rick can call on you to just share what your thoughts are. Anybody willing?
Don't all come at one time, yeah?
Well, but just tell me, why are you a member of HPGS? Maybe just answer that question. Why did you join HPGS, and why do you continue to be a member? Again, pick and choose and ask.
Get ready.
Okay, let's start with Louise Tanswell. Are you there?
Hi, yes, I'm here. So my background is a nurse. Can you hear me?
Yes.
Yeah, nurse, very strong in the palliative hospice division, but I'm also setting myself up as a lymphedema therapist. So I'm hoping to reach out to more people that suffer with lymphedema, not only cancer patients, but also non-cancer patients, which includes those with obesity and venous disease. But I think that, your foundation is especially important now, because it just seems that with COVID, everything is upside down, in particular where the youth seem to be having a priority and letting the elders down by not necessarily protecting themselves and then infecting the elders. I just feel that feel that quite strongly, especially getting all the news updates from Europe and the elders being so at risk because the youth aren't particularly taking the attention that they should. So I feel even more protective and even stronger about standing up and advocating for elders.
Thank you, Louise. Okay, I see, is this Dr. Wong, Warren's iPhone? Are you there? No. How about Pamela at Kaiser? Katie R at Media?
We have some shy members.
Hi.
I do see that Colby Takeda is online.
Judy's ready.
Katie's on. Katie's on. Go ahead, Katie.
Hi, I'm the Special Programs Coordinator from the Mediation Center of the Pacific. To clarify, the question that you're asking is like why we're part of HPGS?
Yes.
Yeah. So many of the times our mediations or family conferences especially are around elders and balancing independence and safety within the family conference. So our Kupunapono program is specifically about that. It's intended to be a proactive program to help elders be able to create a plan with their family about how they want to age, what they want to do, end of life issues, and that sort of thing. And so we really support the autonomy and empowerment of the elders in our community.
Thank you. Okay, how about Patricia Gonzalez?
Hi, this is Judy Sykes. Can you hear me?
Yes, we can.
Let me just share with you. I'm a realtor and have been involved in senior and affordable housing aspects for quite a while. I've been involved with the Coalition for Specialized Housing, and we developed Halabuhalu for seniors. Our first project was for seniors, and then our second project, 2 of the buildings were for seniors and 2 others for multifamily. But let me just share with you, I've been dealing with a lot of residential care clients, and one of the big issues that have come up, and maybe our organization can help, it's difficult for our residential care homes to get licensed, the ones that are really good, and some of them have been built and they have modified their property so that they really in fact exceed the requirements. However, as those of you who are in the field know, it is so difficult timing wise for the licensing problems. And as an example, with this latest client, it took her over 2 years, and even after 2 years, 2 issues that occurred. They had an inspector who was new. A lot of things had to be redone, and then everything just sat. And we realized that a lot of the problem is personnel. What they're indicating is that there are not enough workers, not enough inspectors, not enough people to actually review. And it is unfortunate because I think there are some care homes that we know should be supervised better. And I think at the same time, if we do want to get more online that are licensed and doing it correctly and not above as opposed to under the table, I think we need to do something to assist so that it is not so cumbersome. And people, for instance, this one client lost about 4 months of foster care rents because she was required to vacate her foster care home to finalize the residential care part of it. And after she had done that, she lost all that revenue during that period of time. And actually, in the end, because her license was sitting on somebody's desk, she did plead her case and did get her licensing. But to me, I don't know how many times this story is repeated. And I understand that there are quite a number of people who are not going through the whole process because it is so cumbersome.
Thank you, Judy. I can relate to that. Anybody else?
Debbie, if you have some time, Colby Takeda's on our Zoom today, and he ran the forest bathing in conjunction with HPGS in 2020. If he could give us, we're done with it for last year, but maybe he can give us some insights.
Okay, Colby.
Colby.
Great, yeah. I just want to thank HPGS. My name is Colby Takeda. I'm with the Blue Zones Project. I just wanted to share some photos from our project we did with HPGS. Basically taking the idea of forest bathing, therapy that involves the forest, getting outdoors, walking in nature, connecting, downshifting, and allowing us to go across the island. We did this project across Oahu, Maui, and we meant to go to Big Island as well as Kauai, but because of the COVID pandemic, we had to shift. But we still did a lot of these walks before the COVID pandemic hit. We were able to hit 150 older adults and community members on 2 different islands for these workshops to allow them to connect with nature. It was really interesting to see them reflect on these experiences and get outdoors and in places that they haven't been before, and make this a practice that they can implement on a regular basis. And of course, we know that connecting with nature, being physically active, building community with people around you, social connections are really, really important for older adults. And so we really enjoyed this program that we can do with funding from Kaunani Foundation through the state DLNR. So yeah, we hope to continue this hopefully when the pandemic finishes and we can get back to doing in-person walks. But we did really have a nice time transitioning to virtual walks as well. And we thought that was really nice. We were able to do 150 older adults in these virtual walk settings and actually walk with Phyllis Look, who was our contractor from Forest Bathing Hawaii. But again, thanks again for being a partner with us, HPGS, and we hope to continue to work on behalf of Blue Zones Project with HPGS on different projects.
Thanks, Colby. Yeah, those were fascinating. We really appreciate all that you did to educate us on that process and in the project itself. What I'd like to do is I would like to take this opportunity, since we aren't in person and I don't see very many pictures, if you can at least, for those of you who are not board members for now, introduce yourself, your name, and basically whether you're just an individual, if you're an organization, if you can just share that information with us. So I'm just going to go around. I'm going to start at the top, and okay, on my top of my screen, I have Marilyn. Marilyn?
Yes, Marilyn Seeley. I started out my career in Hawaii in public health, health promotion, and trying to start on that end of the spectrum. But I got an assignment during my field training here at the School of Public Health to go into gerontology. So I very quickly shifted to the very other end of the spectrum, which is what happens to people when we don't have good preventive measures put into place. So that's kind of where I stayed for 45 years. I'm right now still a member of the Policy Advisory Board for Elder Affairs. I've been on that for a very long time. I'm a lifetime member of Kokua Council. Started that back in the 70s when I was a student. Kokua Mau, which is the end of life, been very, very interested in that since we actually got that organization started as an advisory committee in 1999 when we had a Robert Wood Johnson Foundation grant for end-of-life care. So have stayed with that organization. Most recently, I'm involved in a number of committees working together to try to figure out how best to tackle the COVID crisis. That's where I'm spending almost all of my time now, both as, and I straddle 2 worlds. One is, a longtime person working in gerontology and public health, and now I am the recipient. I'm almost 80 years old and can, begin to talk about it from that perspective. So I think bringing those 2 together, I think I still have something to contribute. I've always said that I never really knew, and my mother told me this, you're never really going to know about aging till you get there, Marilyn. You think you do, you know, oh, never mind, mother, I have 40 years in gerontology. Can you just listen to me once? But she said, you'll know when you get there. And I'm still in good health, but you know, I've got a husband that's increasingly needing my help, and all of my friends, and having been through this with my parents, and you know, now with my brother and my sister. So I'm beginning to see what she meant by that. So I'm still very interested in contributing, and as a lifelong advocate. Particularly the issues with aging are getting more complex, not less. We thought we were going to solve all the problems 40 years ago, and actually we did not solve them. We're feeling a great sense of guilt over that, because we thought when we got there it was all going to be fixed because we had all the answers. That's not happening. So I think until the day I die, I'll still be advocating.
Okay, thank you, Marilyn. I'm just informed that Josh, Lieutenant Governor Josh Green is on. There. So
Aloha.
thank you so much, LG, for joining us today. We really appreciate you jumping out of your cabinet meeting to be with us here today. Before you begin, as I mentioned, we are going to be having a Q&A after you're done. So what we're going to ask everyone to do is just list their questions in the chat box, so that, or list them in the chat box so that we can call on them when you're done and they can ask the questions of you. Okay, so with that, Rick is going to be handling that. I'd like to turn it over. And again, thank you so much for all that you're doing to keep us safe and get us back on track to normal living.
You bet. Thank you. Well, thank you for welcoming me. I so appreciate it. This is significantly more fun than the cabinet meeting. So you've done me a great service to let me jump over. And I thought I would start with a brief PowerPoint update. Is that okay? Okay, let me pull this up for us. Oops. All right, let me get a little bit better. Hold on a second. Here we go. Okay, here we are. So thank you for welcoming me. And we're going to go right into where we are with COVID right now. So it's obviously been an extraordinary year. COVID in Hawaii, we remain the lowest. We have the lowest infection rate in the country. These are data, and we'll get new data in 48 hours, but we've been the lowest, our infection rate per 100,000 people. And that's because people have sacrificed quite a lot. And we've been smart in our isolation and our social distancing, though sometimes it doesn't seem that way. We're better than anyone else. So lowest rate in the country. And here is for the entirety of the pandemic. We're second lowest as far as cases per 100,000, second only to Vermont, which has a population that is very rural and smaller than ours by half. They have about 600,000 people. So we have the lowest rate when adjusted for population, except for Vermont, across the whole pandemic. This might be one of the most important things, that we've had the lowest mortality rate, or in the lowest two amongst all states. Once again, we compete very favorably with all the states. Maine and Vermont, very low also like us. There's significant isolation, even though they're connected, into the continental United States. They're very rural. And you could see that we are the lowest in the country, which is very relevant to our talk today, because obviously our kupuna are more vulnerable if we catch COVID. If people are over 65 years of age, the mortality rate can get quite steep. So we've done something special here in Hawaii, and we have to keep it up. Our deaths per 100,000 is 22. We've had 328 fatalities statewide, but that is a very low number as compared to, you could see look at the numbers for New Jersey and New York. I mean, these are large numbers from the pandemic. That's all the way on the right. A couple things from our statewide overview. These are the basics. I won't dwell on this, but obviously mask wearing and hand washing works. We've had almost no flu this year. There's been virtually no cases of flu across the state because people are protected, but it's also protected us against COVID. We are tracing cases. We have about 325 contact traced active, and our healthcare system has stayed intact. As of today, we have 95 individuals in the hospital total. This time 2 weeks ago, we were at 125. I would remind people, 2 weeks ago, we peaked at 322 cases in a day. And today we're at 119 cases. Our numbers have been dropping very steadily. And our Safe Travels program, which requires a pretest before coming to Hawaii, is now being emulated by the whole country for international travel. They're not letting anyone fly into the US without a pre-travel test. specifically to try to keep the very aggressive variants of the virus out. The B.1.1.7 variant from England, which is very contagious, want to keep that out of Hawaii and out of America if we can. And I'm going to talk about the variation distribution a lot here in a second. I think probably people are starting to get more interested in that than the regular epidemic. Our mask wearing rates have been very good overall. We peaked actually at 90% statewide. We've dropped down to 86%. People are, feeling a little more secure because of the vaccination, but we have to keep these numbers up. You could see that it got lower. It's lower on Kauai, down at 78%. They have very few cases there, so I think there's a little bit more sense of security. Maui, Hawaii County, Honolulu, all around 90%. This is super important because if you can get over 90%, you basically stop the virus in its tracks. Here are some of the important things I want to mention. These are the impacts of having had to go through a pandemic for a year. So as you know, we have a lot of people on Quest in our state. We provide health insurance if people are in trouble. And we've bumped up our number of people that have needed Medicaid assistance by 50,000 individuals since March. It's 15% increase. It's pretty big. We're at 380,000 individuals in Hawaii. Now that number will drop again, but that's essentially over a quarter of all of our people now need Medicaid assistance for healthcare. We are the healthiest state. The reason for that is that we give everyone coverage, but there are challenges. And as you can see, the mental health challenges are very significant. Over 40% of people have had symptoms of depression, loneliness, pessimism, feeling overwhelmed at 34%, tons of extra calls to NAMI, more domestic violence. These are all real things. I will even tell you a little vignette. I don't know if you guys were aware of the tragic situation that occurred here downtown where a gentleman behaved very terribly and wounded a woman, and she almost bled to death. It happened in a condominium here downtown about a month ago. That apartment is next to my apartment, the actual apartment next to my apartment. And so it just comes home. Thank God she lived. That guy's going to obviously be convicted of something terrible, but it's everywhere. There are concerns everywhere. So when we emerge from the COVID crisis and we get some hope back to people and their jobs back, we have to see a big drop in these events, because they're not just statistics for me ever. They're very real as the ER doc, but that was actually the apartment next to mine. And my children had to walk by a crime scene for a week. You can imagine. I'm your lieutenant governor. It was crazy. So, I mean, it's very real. Food insecurity surged to 1 in 5 of our people. Of course, that will drop again once people are fully back to work. And our economy has shown signs of improvement. I'll talk about those numbers in a second. But over 11,000 people were in jeopardy of losing their house based on being behind in rent. Here's how you can look at the comparisons. Just like I said, 2 weeks ago, we had an average of 105 people in the hospital. Now we're an average of 96 or so. The statewide totals daily average had peaked up for the 7-day average at almost 140. We're at 111. And you can see the positivity rate for cases has dropped from 3.5% to 2.5%. These are really good signs. This is because at January 5th or 7th, we were seeing the spike from the holidays, and that means Christmas and New Year's together. And now we're well past that. So we're in a much, much safer place. But Maui has had a lot of visitors, and that means a lot of economic activity. So they have had some challenges, but you can see Honolulu is doing much better. This is what the Safe Travels program has done. From October 15th, when it started, till now, we've had 1,055,000 plus people screened. 88% have been exempt, and right now 8,000 people are in quarantine. This is pretty extraordinary when you look at it, because that means 736,000 visitors came, and we have lower rates of COVID than we did when we started. So the program actually worked, although this is not enough visitors to sustain our economy. It does mean, however, that I think about 22 to 24,000 full-time jobs have been restored for the year already, just from this small amount of tourism, and that brings a lot of suffering down. There you can see what the passenger counts look like. They always drop a little bit, of course, once you get after the holidays, but we had a parallel bump by moving up a little bit. Obviously, this is much lower than we're used to, and it drives all of our economic activity. Here's another way to look at the Safe Travels program. The blue is the travel associated cases of COVID, and the red is just us spreading it to ourselves. And so it's been very minimal. It has tracked with, it tracks pretty closely because we give COVID to tourists, believe it or not, and vice versa, but very rarely. It's just the nature of being in a social interaction. But you can see that there's really very little overall risk from travel as long as we keep the lid on with testing, and soon we'll be in a position to use the vaccination as a process to be safer. I've proposed to the governor that he look at February 15th to lift the inter-island travel quarantine if people have been vaccinated, so you could travel freely without having to get tested. February 15th, you'd be safe, essentially. There's some question as to whether people could carry a small amount of virus, but it's pretty minimal. And then 2 weeks or 4 weeks later, consider if people are fully vaccinated and they've gone 2 weeks after that, they'll be immune, that they could also travel here to Hawaii without having to do safe travels, because they won't have active COVID, so their risk will be very low. And that would pretty much restore travel. And we've noticed that other countries are emulating what we're doing. I'm not sure it's that brilliant, but I think that it does provide a measure of extra safety and security in a very, very risky time. Here's where unemployment went. You could see it was not good at all through the summer. It's unbelievable, but look how that blue line crashes when we're downward in a good way when we open the economy again. Some people are still out of work, no doubt about it, but we are expecting a significant, probably, I don't know if it's gonna be the final CARES Act monies, but I was on with the White House today. They are really moving aggressively to get support for the state so that we can get everybody vaccinated faster. And by doing that, we won't have to have as much bailout money to survive, I guess is the way to say it. Here's an economic pulse graph. And again, this just shows up and down economic activity based on some of our travels and our plans. And this is a vaccination. This is the vaccination update that was on the website yesterday. These are the verified numbers of 70,000 doses administered, but the actual number is 86,177. It trickles in from 42 different vaccinators or companies or hospitals across the state. And so it takes a little time for us to check their numbers. But we've actually done, as of yesterday afternoon, 86,177. And that's out of 154,000 vaccines that had been received. It's 56%. And one might ask, well, why haven't you used those other 65,000? Well, those are all scheduled for the next 10 days for people to get that next shot. And so because you have to be scheduled 3 weeks or 4 weeks out from the Pfizer or Moderna vaccine, we have to be mindful of that. Meanwhile, we're getting an additional 33,000 vaccines in this week for new vaccinations. So it's constantly going forward and upward. So if we continue at this pace, we'll be able to do 120,000 shots or 125,000 shots a month. When we add some extra partners, we'll go up even further. And here's where we are right now. This is the 1A category, and we're also into 1B. All healthcare personnel and long-term care facility residents, so kupuna living in long-term care facilities or people who are badly disabled. 50,000 people, that's basically done. There are a few stragglers, of course, but it's available and people can still jump in if they choose. 1B is where we are robustly right now. That's individuals over 75. Everybody should be signing up in the next 10 days if they haven't already gone. And go to hawaiicovid19.com, and all the different links are there to sign up. It's, again, not perfect, but getting better every day. And then essential frontline workers, these are individuals that spend a lot of time front-facing large numbers of people and in work in things like harbors, on our power grid, things that, though everyone is important, period. I hate using the word essential, but these are things that otherwise state functions drop if we don't have those folks working. So that's another 150,000, this whole group, and it should be done hopefully by the end of, heck, I'd say if we get lucky, end of February, otherwise a little bit into March. That would be very helpful. And then here's some definitions. These are the prioritized frontline essential workers. You guys can have the slide deck too if you want to look at it later. But you can see first responders, corrections officers, emergency services folks, government operations, critical infrastructure for transportation. Education is up next. and postal workers. So you can see how we're front facing everybody so that they don't, it's anybody who's a kapuna or those who are supporting our elderly community. That's the goal really to the vaccination program. And then we move into 65 to 74, which starts, I would say, almost exactly March 1st, which is a Monday. We'll be able to vaccinate the rest of our community. So that's a bigger group. That's also people with underlying health conditions. But as we get more vaccine, and I think this is going to coincide with getting the Johnson & Johnson and the AstraZeneca vaccine, you're going to see a ton of vaccine being done in March. So these are the highlights, and I can answer a lot of questions on this. I'm sure you guys have questions. Some additional considerations for essential work group, we still want to prioritize based on age. So the oldest individuals, like let's say someone's working in a grocery store, they are 1B category because they're front-facing people. But if say someone is 71 years old and they're working at a grocery store, which happens, then we want them vaccinated long before the 30-year-old or the 22-year-old that might be there. Because once again, we want to decrease the risk of someone getting very sick. We also can vaccinate some geographical prioritized areas if like there's an outbreak and we've got to go help a housing project or something so that it doesn't spread to the hospital or amongst themselves. Phase 2 and 3 are the general population. That should be in the summer, probably May. This would just be like your 38-year-old daughter, healthy in every way, home raising the kids or maybe the husband's raising the kids. She's working. She may be a essential worker and got vaccinated, but he is lower risk. This would be in May. That's how that would work. They're asking us not to call it Operation Warp Speed anymore. I'm going to come up with some crazy name for it, but it's the vaccination program. The resources are there. So you really want to go to Hawaii COVID-19, and it's super duper important to be able to sign up there. You guys should use my social media. We update people all the time. If you'd like, it's at LTGovJoshGreen, or you should text me on my cell phone, which is 937-0991, 937-0991, and I can try to help. But basically, this is where the pods are, and we'll be opening up more as we go. So this is how to sign up. And that's it. I thought I'd pull up short there. That's my email. You have my cell phone. Just please be in touch for emergencies, and then I can answer any questions you might have. I think it's going to be a very dynamic process, and we will get back to somewhere around 70% of tourism at least, maybe even higher by fall, because we will not be restrained. And a lot of people have, because they've been home, have passed up on 2, 3, 4 trips. And so Hawaii ends up within people's reach, believe it or not. So I would expect we're going to see a lot of economic recovery. For good or ill, the extra travel will be here. But for good, I think, to get our healthcare systems, solidified and our budget solidified. You definitely can have this PowerPoint deck. I see that question came up, and I'll have Jordan from my team forward it to you if you don't have it already. And I update it every couple of weeks, so I'm happy to give added numbers. These are the most updated numbers in the state, though. I mean, some people, I have numbers that sometimes even the director of health doesn't happen because I go to our source people and I bug them until they relent and give me the numbers early. So that's the presentation. Is it okay if I pause there and take questions?
Sure.
Yes.
That was excellent, Lieutenant Governor. Thank you.
Thank you.
You certainly do have several questions, of course. So the very first, before you even started, was from Kathy Wyatt. She had a couple questions. Kathy, would you like to ask your questions, or would you like me to ask them? You can unmute if you'd like to ask.
Go ahead, Rick. You can ask them.
Oh, all right. So our first question, Lieutenant Governor, is, well, actually 2 people asked. Marilyn Seeley and Kathy Wyatt both asked about using the military, National Guard, to help with vaccines. And apparently Biden has signed something today around that. Are you aware of that? And can you address that a little bit?
Yes, we were only getting 75% reimbursement on our use of our military. Now we're going to get 100% reimbursement. So we'll be able to use our military more for any of the projects we have to do around COVID. And that includes vaccines. That includes the logistics around the vaccine programs. We have enough healthcare workers to deliver the shots, it turns out. So they're awesome. I mean, I've spent a lot of time with the National Guard these last few months.
Excuse me, this is Marilyn. Yeah, my question,
Go ahead,
Lieutenant, yes, my question, Lieutenant Governor, had to do with resources. And I wanted to know why we don't use not just the National Guard, but all of the military resources here are very rich, extremely well organized. They can put it together in no time at all. So my question then goes back to, if we had every vaccine we needed right now, where would the barriers be to getting it into people's arms? Because nationally, I do not see a sense of urgency like we should. I know you all are working night and day and you feel that urgency, but overall as a systems, I don't see that. And the other thing I don't see is, are we doing a systems analysis of the whole method of getting this into people's arms? I had my vaccine yesterday and it was pretty well organized, but there's room for improvement. So it's a resource question other than just the number of vaccines we have. And what do we need? What are the barriers and how can we help to knock those barriers down fast? Because we need to be the state that says we are doing really well, but we want to be perfect. We don't want to have another single case of this. And maybe we're a little closer to that than just about anybody else.
The only barrier is getting enough vaccine into the state. We have more than enough sites now to vaccinate people. We can vaccinate, we have the capacity right now to vaccinate 60,000 people per week. So we would need that many shots or that many doses, which would be 250,000 doses before we would exceed our capacity. So right now we're well below that. Having the military help us would be great. They're doing, of course, their own entities. So they're vaccinating all their own people, but we have enough sites. That really isn't our problem. It's the only real bottleneck at the moment. Well, I shouldn't say the only one. We would like to have some more resources. We've had $12.7 million appropriated. It's going to cost us $30 million to do it, but we're going to get that resource, I'm fairly certain, from the new administration. Alternatively, we just have to have the vaccine. And so they're going to be ramping it up. The president has finalized the plan already. We're in day 1 or day 2 of the new administration. So the urgency is totally there. It's a question of getting enough vaccine produced. We will get it at the same rate as any other state, not faster, not slower, based on population. We've actually gotten a slightly higher percentage of vaccine to our state than we merit based on population, based on my calculations, but it's very close. And that's it. It's really going to just take having the vaccine in the state. And there's not a way to accelerate it. I had an individual that was willing to buy us 1 million doses, but they're not allowed to buy from the companies outside of the federal channels. It's not legal. So we can't do that.
How about getting into people's homes where they cannot come out to these mega sites?
We already have a plan from the Department of Human Services to go for people who are homebound. It'll be a lot slower, and it has to be a slightly lower priority, because the first priority has to be to get mass vaccinations done. That's super labor intensive, but we actually are going into care homes already that are even 4 and smaller, 4 people and smaller. For just individuals who live independently, who might be very elderly, that is part of the plan I've asked them to engage on. But you can imagine that you might only be able to do 30 doses a day or 40 doses a day at that rate. And if someone's fully homebound, in general, they're at lower risk. But I'm mindful, of course, if they're being cared for by their niece or nephew, it could be at risk. The better approach in that case, though, is to get their niece or nephew and the other, 600,000 nieces and nephews vaccinated right away, so that we can do that. We expect the pharmacies to go into the households also. That's very likely what we'll do with the smaller pharmacies. It really is a question of getting enough doses now into the state.
So another question, thank you, is I've been hearing that you have to sign up for your vaccine online if somebody doesn't have an email address or computer access. Is that still an issue, or can you address that?
People can do it at the site. It would be best if they had a loved one use their email, like a child or a grandchild, and sign them up. That's fine. They can put all the information for their tutu or whatever, and then just get the email that way. So they won't get shut down. And there was the question, I will say, also of vaccinating the caregiver with the individual that showed up. From a public health standpoint, it's probably sound policy, but it's a little controversial when you have a shortage of vaccine. So better to just get the most vulnerable people vaccinated.
Right. So how about this mutated versions of the virus that's floating around out there? How is that going to affect things, do you think?
The vaccine will work against it. It takes 5 to 7 years, we're told, from a microbiologic standpoint before a vaccine wouldn't be adequate. Interestingly, because they've used this new technique of mRNA, they're able to sequence new variants and within 5 to 6 weeks actually produce an adjusted vaccine if they really need to. But they haven't found that it's been necessary yet. They will be studying that constantly, though, so that month over month, they're going to continue to assess people who got vaccinated, and then though it'll be a small number who caught COVID, they were either unlucky and they didn't have a response, or they got some maybe very strange variant. And so we'll follow that closely. The variant, the B117 out of England, is 60% more contagious, but not more lethal.
Right.
So, you know.
Okay. Okay. And then we've been hearing a lot about, even though you get vaccinated, how important it is to keep wearing the mask. Can you address that for folks?
Yes. So the masks will protect you well over 99% if you wear your mask religiously, as does the person across from you. The vaccine, you only get 52% immunity after the first shot, and it takes 10 days to 2 weeks to get that immunity. So masks are still critical. We are getting the data back from the feds and some researchers even here as to how often people can still carry the virus even if they've been vaccinated. We think it's going to be at a much lower rate, but not nothing. So until we get herd immunity, we'll probably ask people to still wear masks when they're in public.
And then I was just before you came on, and when I had a little breakfast, I was listening to HPR, and it was All Things Considered, and they were talking about the long-term effects that are going on. Can you address that a little bit? I mean, after somebody's had COVID and some of that issue?
Yes, COVID, it depends how bad your case is. Some people have virtually no sequelae. I had COVID, only a mild case in September, over September 11th.
Right.
But some people had pretty severe chronic disease afterwards. There's been a lot of people describe some encephalopathy, that's where they say foggy brain. And they think that there's inflammation of certain systems. Could be the kidneys, could be the brain. And so people have some weak fatigue afterwards in some cases. There's just a lot of unknowns. This disease is still only 1 year old. And therefore we don't know long-term yet. It seems to be affecting individuals that already had underlying chronic disease much more severely. Like if people have bad diabetes, what have you, it's tougher. So that is one of the big challenges. And then one of the incentives to get vaccinated. Again, if people are philosophically in favor of it, I don't sense a lot of anti-vaccination sentiment here on this call, but maybe 20%. We think about 80% of our people, 59% said they want to take it right away. Another 21% said, assuming things don't go badly, they'll take the shot, and then the last 20% probably just isn't interested, but that will be enough to get us protected. And, I tried to do it by example, to go get the shot as a physician. I think that everyone's got to soul search and decide, but most of the people that decide to get the shot list their number one reason as protecting the people they care about near them. And I think that's a pretty easy to get.
Sure. Yeah. Well, maybe a follow up on that. So I have been hearing some folks getting the vaccine that have ended up with some flu-like symptoms. Can you talk about what we're seeing there? Just
yes,
a little bit.
Yeah, people are getting especially from the second dose. Usually, the first shot usually just results in a little bit of a sore arm, which I had. The second shot results for some with myalgias and arthralgias, meaning muscle aches and joint aches. And that's kind of the flu-like symptoms. And I did feel that for 6 hours, creepy, crawly skin, and I felt feverish, although I didn't have a fever. I just took a ton of Tylenol and it went away. But, it was not that bad. But interestingly, it felt a little bit like the COVID symptoms that I had when I had COVID, just to tell you the truth. But it was really short-lived. Wow. Yeah. For that, I had 2.5 days of feeling like terrible. This one, it was really self-limited, and so it was okay.
Right. Well, and then along those lines, I've also heard after you have the vaccine, even though you have the vaccine, you can still spread COVID. What happens there? Is that true?
He already said.
We're still looking at that data. Yeah, we think that it'll be way lower rates, probably 5%, like down 95%. People tend to spread viruses at their highest levels when they're very symptomatic, meaning they have a high viral load. So like if you've got the flu actively, that's when you're most contagious, when you're shedding a ton of the virus. So if you're protected against catching COVID, though you may have some of the COVID, viral particles in your upper airways, the nose or throat, you're not going to have enough to be at great risk. But we still need to see those studies. I think it is safe to say that using, fully vaccinated status as a way to clear people travel or to be around others is a sensible approach. But we do want to be a little careful until we see that we're on the other side of the mountain on this thing.
Right. Well, then Kathy also asked if childcare staff are included, why weren't adult daycare folks included?
In the 1B,
since-
in 1B.
In the 1B, yeah.
Yeah, they really should be. I'll go back and check that. Adult
Right.
daycare and childcare should be absolutely. In fact, adult daycare are even more
Right.
should even be more prioritized because they're with other individuals that are more
Yeah.
senior. Frankly, in my opinion, that's healthcare, and that should be 1A. Honestly,
Really?
So
Seriously.
that should be revisited if it hasn't been clarified yet.
Okay, that's Kathy's Kuliana.
Thank you.
Yes.
Let's see. I'm kind of reading as we go along now. Let's see if we answer this. Eileen, did we answer yours? Any ideas on how we can help older generation actually get in line to sign up for vaccines? How we can create a service for them if they have no tech? So we talked about that a little bit, but I would say that's the anxiousness that we hear oftentimes from folks. Just how do we get mom vaccinated safely?
There's another. So for the what's going on now is HMSA, who does insure like 700,000 people in the state of Hawaii, is running the phone bank for the Queens pod, meaning that they're going to be able to take phone calls from people. And I think a lot of seniors do prefer a phone conversation rather than a web link or an app. So that's going to be available. And a lot of times we're just going to get your name there, and then you'll be able to walk through it with somebody at the site. It'll be slower though, and it's nice to just buzz in, get your shot, get out of there. So if people can get help, it'll be good. We're also using AARP and I think PABIA to be supportive. So there's lots of ways to be supportive. Eventually, we're going to get to the place where you'll just go to the pharmacy to get vaccinated, but that's probably not until the summer.
Yeah. So I guess a question I have just personally is, why are primary care physicians not able to give the vaccine? Is it just a refrigeration issue or?
Yes, that's right.
So primary care, yeah, okay.
That's exactly
thank you so much, Lieutenant Governor. There were a lot of questions, and it is so wonderful to be able to ask them directly to you and get the response immediately. So I just want to throw this out there for the last few people that may have not had your questions answered, but it's a burning question. Is there anyone that has a question that did not get covered that you really came on just to ask it? No?
We have a couple minutes.
Yeah, there's
Go
a few.
Yeah. Okay.
Yeah, do you
Dr.
mind?
Ono?
How much?
Yeah.
Yes, please, Dr. Ono.
Okay. This is Sean. I'm a professor of Seisei University in Tokyo, and but also I'm studying about elderly care homes in Hawaii as adjunct professor of University of Hawaii. And I interviewed some people and especially foster home cares managers and also residential care homes suffer from damage and suffer from net income, loss of net income and the shortage of care workers. So how the local government is going to respond to their problems, especially for small size care homes or elderly.
So if it's loss of income, they may need to go, there may be limited options, but sometimes the PPP loans might be possible. And that'll depend on how the Biden administration puts money into the next CARES Act. Of course, a lot of people are seeing fewer clients because, well, in some cases people passed away from COVID, not too many people here, but also others, families took their family members home. I think that trend will reverse once people are vaccinated and are safer. The best thing I could tell you is the answer to most of these questions, whether it's economic or unemployment related, is getting us vaccinated so that we can open up safely without risk. And when we get to 500,000 or 600,000 people vaccinated in the state, particularly our elderly, we'll be able to have travelers here without risk at all. I hope that they'll be vaccinated or tested like we have the plan in place, but this will make a lot of things possible. For homes, we're now going into the care homes to actually vaccinate people. And that's the program I mentioned. That's Dr. Toma and Dr. Yazawa. They're running that program.
Thank you. There was a question from Haoli regarding immunizing islands of Lanai and Molokai to get herd immunity faster. Would you mind addressing whether that's going to be a possibility at all?
It's amazing because I just pulled up the slide. So Molokai has, for the population that's due to get vaccinated, it's 5,057 people. That's 0.4% of the population. So far, they've received 0.66% of the state's allocation of vaccines. So we're trying to get them there, but we're not going to do a special vaccination program for any individual island. And there's a reason for that. I kind of love it over on Molokai and Lanai for that matter. But imagine if Oahu said, we're going to vaccinate all of Oahu before we get to the neighbor islands. The freak out would be immense and appropriate, because that would put all other neighbor islands back 6 months. And so we can't really reverse fields and do that to people. There might be a different argument that could be made, which is that because of lack of healthcare access, you want to get people vaccinated somewhat sooner. But it's a reach, honestly, to accelerate one region over another, because it will create competition and a sense of it'll be disruptive to people's overall agreement to participate as one state if we do that. Part of me likes the idea, but I can see what the fight will be if we do that. So we're probably going to just stick with the acceleration to all places rather than one over another.
Okay, thank you. Last call, one more burning question, and then we're going to be closing our meeting, and so we can let Marilyn, anybody else?
My last question is, how can we help you, Dr. Green? What's the best way the community can help you?
I think the very best way would be to help every individual that you know who may not be on our call today. Help them coordinate their getting of their vaccine. Get them there, get them to the sites, to the centers, help them through the website if they're more savvy than they, and encourage everybody to get vaccinated, especially those who are over 65. That would be the very best thing to do. It's always good to have positive feedback in the press and the media, the media in general about your experiences so that people aren't afraid. But that would be great. And if you could do that and keep people a little bit calm, although there's always a spike of impatience right before we get a surge of activity. It's very natural. Just people are naturally anxious that things aren't getting done. So I can tell you that now we vaccinated as many people in the last week as we probably did in the previous 2 weeks before that, just because we're now getting ramped up. So it would help if you could get a lot of people to the vaccination sites, if you have extra time and they otherwise have some challenge, that would also be very good. Because I like what I'm seeing at the decrease at the hospitals and the decreased number of fatalities. So please engage that way. And if there's an opportunity, believe me, I will get Washington, D.C. to give us more vaccine. If there's any opening at all, I told them today, we are ready. The state of Hawaii is ready. We can do the whole thing in 4 months, the whole state. If you delay, it'll take us longer. But if you want a success story, send it our way. And your questions were right on the mark. I mean, if we were to more than double our vaccine get over 250,000 doses per week, I'm sorry, forgive me, per month, we would then have to ramp up our capacity, and we would. But we probably would just do double time shifts. We'd probably add a second shift to each of our current centers so we didn't have to get new infrastructure. We would just pay more people to be on duty to vaccinate. I hope that's a good enough answer to your question. I really appreciate, though, that you spread the word, and my team will give you these slides, and I can come back again in a month or two and give you another update of where we are. By then, hopefully everybody who's on this call has been fully vaccinated.
Oh, I would love that. Okay, thank you, Lieutenant Governor.
Thank you, Debbie.
Thank you again so much for spending all this time with us. I know that everyone here is just thrilled to be able to have access to you and for all that you're doing on the front lines. Okay, for our members, I just want to remind you, I thought I saw Eileen raised. That was for someone else. Okay. I just want to remind you that if you have not renewed yet, please renew your membership. On the last page of HPGS newsletter that was sent out earlier this week, there is the renewal form. So make sure that you do renew your membership. If you know of anyone who could either benefit from being part of the organization or who could be a resource to us as well, please encourage them to become a member. We really want to make this a more active year. We think it's really critical, more than ever our kupuna need us. So please try to get as many people as you can engage in the conversations that we're having to improve what we're doing for our population. We look forward to seeing you all at the next general membership meeting, which is Thursday, April 22nd at 11:30. And until then, thank you again for joining us. Stay safe. Take care.